Emma, and I'm a student at Upstate Medical University. I'm in my second year of PT school, and I am on my first clinic, which is acute care in the hospital at Upstate. So I'll start off about going through a day in my life. Every day when I get to the hospital, I check my schedule. The schedule usually changes every day based on patients who are discharged or just got into the hospital. So I will chart review all the patients on my schedule, go through their past medical history, past surgical history, see if they have any precautions, any nursing orders, anything that I should be aware of. After chart reviewing all my patients, me and my CI, we meet up and we talk about each patient, just do a little recap on a few things about each patient. After we do that, we decide where we want to start our day. Some patients, after seeing them a while, they're better in the morning or better in the afternoon. And in acute care, you kind of can make your own schedule and see patients when you want to see them. So we'll pick which patients we go to. Once we go to the patient, before I go into the patient's room, I check to make sure they have all the equipment they need in there. Usually always have a gait belt on for safety. Sometimes patients will need oxygen tank, walker, wheelchair, so you just want to check before you go in. And you always write down the time you go in, because for the hospital they bill by units, which is time you're with the patient. So it's important to keep track of what time you walk in the room and what time you walk out of the room. So if it's a regular treatment with the patient, we work on things we would normally work on with them, like walking, going up and down stairs, bed mobility, getting in and out of a chair, stuff that they need to be doing to be able to be discharged from the hospital. If it's an eval, usually we start off by asking the patient questions about their past medical history, their home setup, which is a very important thing to know in acute care, and we check their range of motion, strength, sensation, and then we have them get up and do some mobility for us. It's important to have your patients attempt stairs if they have stairs at their house. Basically, you want to see them doing the things that they need to do to be able to get back into their house, like walking stairs, getting in and out of chair. If they can't do these things, we recommend rehab if they need it, or we keep them on program to work with them in the hospital to get PT while they're there. So after we see about 2 or 3 patients, me and my CI reconvene, we write our notes together. I write my notes, he writes his notes, and then he goes over my notes with me about anything I need to change, things that went well. So we do this a few times. We see a bunch of patients, then do notes. Lunch, you can go whenever because you make your own schedule. So when you feel that you're at a good point with seeing patients, you can take your break. At the end of the day, me and my CI meet up again, make sure all the notes are signed. We kind of talk about things that went well, things that didn't go well, things that can be worked on throughout the week, and we go through our schedule. You can delegate patients to PTAs if you feel like if they're able to walk, then they don't need the help from the PT, you can delegate them to PTAs. The patient population that I've been working with in the hospital are patients who are post-abdominal surgeries. I have some post-trauma patients, things like car accidents, falling down the stairs, falling off ladders, broken bones. I also have seen patients in the ED and some patients on the neuro floor. What makes the acute care setting so unique is that it's completely different every day. You don't know who you're going to see, what type of patients you're going to see until you get there, and it changes up every day, so it's not the same thing every single day. Another thing that makes it unique is that you can make your own schedule, so it's not assigned from 9 to 10 you have to see this person. It's kind of when the patient is available, and when you're available you can go into the room to see them. Another unique thing about the hospital setting is that you get to interact with other healthcare professionals like OTs, speech language pathologists, nurses, doctors, PAs, and case managers. Before coming to the acute care setting, I recommend students are familiar with a few things. I recommend that they're familiar with all the different lines and tubes, because a majority of your patients will be connected to lines and tubes, so it's important to know the purpose that they serve. And another thing you should be familiar with are the different assistive devices used. I've seen patients use walkers, wheelchairs, canes, crutches, and you should be able to instruct the patient on how to use them. And another thing I think students should be familiar with are different types of transfers. I've used Sarah Steadies, Hoyer lifts, slide boards, even just like a stand pivot. It's important to be able to instruct the patient on how to get from a bed to a chair, or just get up out of the chair if they need assistance.